Thanks so much. My name is Ann Rankin, and I'm the Acting Associate Head of Clinical Education at UBC. Sue Murphy, unfortunately, had to take off to attend a medical appointment, and so I said that I would step in. So right now, I'm Ann Sue, because normally I'm just Ann Sue. So I do, as all of the students will attest, crash AV systems on a fairly regular basis, so I'm hoping that we're good to go. I'm very pleased to be able to present the public practice pearls this afternoon. The dictionary, I'm supposed to click something. Oh, no, I'm good. Okay. The dictionary has two definitions for the word pearl. The first definition is it's a hard, lustrous, spherical mass, typically white or bluish gray, formed within the shell of a pearl oyster or other bivalve mollusk, and it's highly prized as a gem. But it really is the second definition that is most appropriate for our context this afternoon. So from the world of public physiotherapy, okay. It's a precious thing and the finest example of something, and we really have three of just that for you for the next 20 minutes. I wanted to introduce at the beginning Kelly Kavanagh, who's going to present on complex regional pain syndrome. Kelly has worked at St. Paul's Hospital for over 18 years and is an outpatient clinical specialist in orthopaedics.
How's that? Can you hear me all right? Okay. Good afternoon. Thank you very much for the opportunity for being able to present my presentation on why not ICE regarding complex regional pain syndrome, or CRPS. Unfortunately, as I'm sure you all are aware, that this is certainly a scope of discussion that goes beyond a 5-minute presentation, but I hope I'll be able to provide you with some insight as to why we do not recommend the use of ICE with these particular patients. So I think the first thing to realize is to recognize the differences regarding the types of causes of inflammation that occur with the non-CRPS patient and the CRPS patient. If you think about an ankle fracture in a non-CRPS patient, certainly swelling and inflammation is going to be normal, and it will involve, as you know, tissue destruction and injury, blood vessel disruption, and certainly the stages of inflammation itself involving the leukocytes. In the CRPS patient, certainly their injuries are very you wouldn't expect them to create the reaction and the swelling and inflammation they do. Historically speaking, we've had some rip-roaring, if you want to describe it, CRPS patients who have simply bumped into chairs and they have become very disabled by it. But their inflammation is more caused by a central-based situation, glial cells potentially around the nerves themselves, and ICE in itself will cause inflammation and swelling in these patients. We know from research that CRPS patients, their thermoregulation is abnormal and they have increased vasoconstriction in the blood vessels around their injury, yet there's no measurable increase in the vasoconstrictor hormones. And what they've found is that these patients, for some reason or another, have increased hypersensitivity to vasoconstrictors. So when you think about adding ICE as a modality or treatment choice, ICE is causing further vasoconstriction on something that already is hypersensitive in terms of vasoconstriction. It is causing further cooling and further increased pain and inflammation and irritation, and in turn it's increasing their sympathetic drive. I think understanding the nerve response to cooling is important. If you block or cool a somatic sensory nerve, it stops functioning when you cool it down to 20 degrees Celsius. At that point, the sympathetic system kicks in and starts to modulate the pain. But unfortunately, C fibers are alive and well and conducting their pain message, and they don't stop working until you cool them down to 0 degrees. So we're just inviting irritation and problems. So using ice will further aggravate complex regional pain syndrome, and it may actually even be contributing to the CRPS development. So at the St. Paul's Pain Center, we certainly take a multi sort of approach to it because it is a complex pain problem. And so when we are working with our patients, we do not encourage them to work through their pain, and we try not to have their pain increases in the visual analog scale go more than 1 or 2 notches out of 10. Of an increase, that is. If their pain is increasing and they can't tolerate the treatment, then they are certainly encouraged to stop and rest. And if they continue to have a problem, then we tell them to call it a day, take a break, go do something else, come back and try again later. We know that relaxation and deep breathing is certainly an important part to help control pain. The relaxation and deep breathing, we encourage 2 or 3 deep breaths every half hour, and we know that this reduces the stress hormones in the blood, which in turn will help bring down the sympathetic fight or flight. So for swelling, obviously we're not recommending ice, but gravity assistance is very important, gentle muscle pumping, warmth to help open up nutrition and get the circulation for oxygenation and rewarming the tissues that are irritated, and gentle massage. But be careful with gentle massage, as not everybody tolerates that. Some people are very hypersensitive and allergenic, and that might be something you need to put on hold for later. Pacing is very important for these people, avoiding heavy exercise and focusing on a little bit often with frequent rests. Vibration is not tolerated, and in terms of desensitization, we encourage through comfort sensory input, so mirror therapy. Traditionally, CRPS patients do not tolerate the traditional desensitization methods like rice, popcorn, that kind of thing. That's not to say you can't use it. Be very cautious. They may not tolerate it initially. So in conclusion, based on current research, it's advised that we do not use ice, and we certainly do not use contrast baths. At the bottom there is a brief, not in detail reference, but if you would like the reference lists in more detail, I can make them available to you. Thank you.